Welcome to Gateway 101. In today's live broadcast, we're going to be talking about thyroid. Okay, thyroid, as you know, it is a medical emergency, and we're going to be talking about some of the systems that you have to pay attention to. If you're experiencing any of those symptoms, or all of the symptoms that I will be mentioning, it is a medical emergency and it can be fatal. So make sure you run to the ER immediately so that you can better be diagnosed and treated. Okay, so in today's live broadcast, we're going to be looking at hyperterrorism, hypothyroidism, thyroid overview of thyroid. What is thyroid? What causes thyroid? How can it be prevented? So we're going to be looking at all that. We're also going to be looking about how is thyroid treated at the hospital, treatment for thyroid. So we're going to be looking at all that. What causes thyroid? We'll examine that. What is thyroid? We'll look at that. Common trigger. What trigger thyroid? We're also going to be looking at all that. Okay. Symptom of thyroid. We're also going to be looking at all that too. Remember, while this does not constitute diagnosis or treatment, we are only creating healthcare awareness in Gateway 101. Okay, we don't diagnose in this channel and we don't treat. Okay, we only provide simple home remedy to help alleviate your symptoms. Okay, and we also encourage you to seek medical help if home remedy did not work. Okay, home remedy never constitute proper medical treatment. Okay, it is just a simple help tip to help. Okay, so this is Gateway 101. So let's get into today's business. So in today's video, we're going to be talking about thyroid. Okay, I will say that thyroid, it is a medical emergency. Okay, if you're experiencing thyroid, we strongly encourage you to seek medical help immediately. So what is thyroid? We say that thyroid is a rare but life-threatening medical emergency caused by an extreme sudden surge of thyroid hormone in the body. It is a severe complication of untreated or poorly controlled hypothyroidism, most commonly caused from grave disease. Okay, it is a medical emergency. Thyroid, once again, it is a medical emergency. It causes the body metabolism to become dangerously overactive. So what causes thyroid? Thyroid usually happens when someone already had hyperthyroidism and a major stress triggered it. So in other words, you might have hyperthyroidism and you may not know because you have not been diagnosed, or you know that you have hyperthyroidism and you did not properly take care of treatment, or you do not properly handle the situation. So a common trigger with a common stress will trigger it. And thyroid, like I have said, it is a medical emergency because it can be fatal. Okay? So let's get into it again. We say thyroid usually happen when someone already had hyperthyroidism and a major stress can trigger it. So what are the common triggers untreated or poorly controlled hyperthyroidism can trigger thyrostome. Infections such like pneumonia, urinary tract infection, fevers can also trigger thyrostome. Surgery, especially thyroid surgery, can also trigger thyrostome. So, severe stress or trauma can also trigger thyrostome. Heart attack can also trigger thyrostome. Stopping thyroid medication suddenly is a major trigger factor. Okay, if you are taking any thyroid medication, please do not stop it suddenly. Okay, so stopping thyroid medication suddenly can trigger thyrostome. Childbirth can also trigger thyrostome. Iodine overload, context dry or setting medication can also trigger thyrostome. Okay, symptom of thyrostome. This condition progresses quickly. It is a medical emergency because this condition, the symptom of thyrostome, this condition progresses quickly and can be fatal without emergency care. So, very high fever, often above 103 Fahrenheit or 39.5 degrees Celsius, is a medical emergency. This is one of the symptoms of thyrostome. Severe rapid heart rate, tachycardia. If you're experiencing severe rapid heart rate, it is a symptom of thyrostome. In medical term for severe rapid heart rate is tachycardia. It is a medical emergency. Irregular heartbeat. If you're experiencing irregular heartbeat, it might be a symptom of thyrostome. You're having a high blood pressure earlier, then later become low blood pressure. It is a symptom of thyrostome. You are agitation, you are confused, delirium. You are experiencing a symptom of thyrostome. You are sweating, severe sweating can also be a symptom of thyrostome. Okay, you are shaking, tremors is also a symptom of thyrostome. Shortness of breath is also a symptom of thyrostome. Shortness of breath, which can later result to possible coma, is a common symptom of thyrostome. Okay, this is a medical emergency. So if you are experiencing any of these symptoms, know that this is a medical emergency. Call 911. Okay, immediately if thyrostome is suspected. Okay, so how can thyrostome be prevented? How can we prevent thyrostome? I would say that prevention focuses on properly managing hyperthyroidism. Do not forget that thyrostome can be triggered from hyperthyroidism. You're having a hyperthyroidism can, if it's not properly managed, can trigger thyrostome. Okay, so treat hyperthyroid earlier. Work with doctor to control thyroid level using anti-thyroid medication, radioactive iodine therapy, and surgery if needed. We're talking about how can thyrostome be prevented, and we're saying that never stop thyroid medication suddenly. Stopping medication abruptly is a major risk factor. It triggers thyroid storm. So treat infection quickly. Get prompt treatment for fever, pneumonia, urinary tract infection, or other infections because they can trigger thyroid storm. Okay, so inform doctor before surgery. If you have a thyroid problem, make sure but especially if you have hyperthyroidism, make sure you inform your doctor before any surgery because it can trigger thyroid storm. Ensure it is well controlled before any procedure. Okay, regular thyroid monitoring is highly encouraged. Routine blood tests so that your TXH, T3, T4 help prevent complication. Okay, who is at risk for thyroid storm? Who is at risk for thyroid storm? Okay, I was saying that, and we are saying that people with untreated hyperthyroidism, they are at risk for thyroid storm. Those with grave disease is one of the triggering factors we have said. Grave disease will lead to hyperthyroidism. So those with grave disease, they are at risk for thyroid storm. Pregnant women with uncontrolled thyroid disease, they are also at risk. Elderly patients, they are also at risk. The bottom line is, thyroid storm is a rare but extremely dangerous. It almost always occurs in someone with known or undiagnosed hyperthyroidism who experiencing a major trigger. We talked about a major trigger of thyroid storm already. So early treatment of thyroid disease, it is a strong prevention. Okay, so for the sake of those who are just joining us, let us recap real quick. Okay, let's just recap real quick for the sake of you who are just joining us. Let's brush through, let's recap what we are talking about. We are talking about thyroid storm. What is thyroid storm? What causes thyroid storm? How is it prevented? How can it be prevented? And we said that thyroid storm is a rare but life-threatening medical emergency caused by an extreme sudden surge of thyroid hormone in the body. It is a severe complication of untreated or poorly controlled hyperthyroidism, most commonly from grave disease. It causes the body metabolism to become dangerously overactive. And we also said that what causes thyroid storm? We said that thyroid storm usually happens when someone already has hyperthyroidism and a major stress triggered it. The common trigger will be untreated or poorly controlled hyperthyroidism. Infection can also trigger it, like pneumonia or urinary tract infections. Fever can also trigger. It can also be a triggering factor. Surgeries, especially thyroid surgery, can trigger thyroid storm. Actually, number one trigger of thyroid storm is surgery. Thyroid surgery can trigger thyroid storm. I also said that severe stress or trauma can also trigger the thyroid storm. Heart attack can also trigger thyroid storm. Stopping thyroid medication suddenly is one of the major causes of thyroid storm. It's one of the major triggers of thyroid storm. Okay, childbirth can also trigger thyroid storm. Iodine overload, context dry or certain medication can also trigger thyroid storm. The symptom of thyroid, this condition progress quickly and can be fatal without emergency care. So a very high fever, or often above 103 Fahrenheit or 39.5 degrees Celsius, can also be a symptom of thyroid. Severe rapid heart rate, also known as tachycardia, can also be a symptom of thyroid. Irregular heartbeat can also be a symptom of thyroid, and all these are medical emergency. High blood pressure earlier, then low blood pressure late is also a triggering factor. It's also a symptom of thyroid. Agitation, confusion, delirium, all symptom of thyroid. Vomiting and diarrhea, they are all symptoms of thyroid. Severe sweating, shaking, tremors, shortness of breath, possible coma. This is a medical emergency. Call 911 immediately if thyroid is suspected. Okay? So how can thyroid, we also talk about how thyroid can be prevented. I will say that prevention focus on proper management of hyperthyroidism. We also say that treat hyperthyroidism early. Work with a doctor to control thyroid level. Anti-thyroid medication may also be prescribed. We're talking about thyroid we're talking about how thyroid can be prevented. Okay, we're always putting emphasis on prevention because we believe that prevention is better than cure. So radioactive iodine therapy can also help prevent thyroid. Surgery, if needed, can also help prevent thyroid. Never stop thyroid medication suddenly. We talked about that before. Stopping medication promptly is a major risk factor for hyperthyroidism. Treat infection quickly and get prompt treatment for fever, pneumonia, urinary tract infection, or other infections. Inform doctors before surgery. If you have hyperthyroidism, ensure it is well controlled before any procedure. Okay, so irregular thyroid movement monitoring. Irregular thyroid monitoring. A routine blood test TSH, T3, T4 help prevent complication. Okay, who is at risk for thyroid? I would say that people with untreated hyperthyroidism, they are at risk for thyroid. Those with grave disease, they are also at risk for thyroid. Pregnant women with uncontrolled thyroid disease, they are also at risk. Elderly people are also at risk. The bottom line, the thyroid is a rare but extremely dangerous. It almost always occur in someone with known or undiagnosed hyperthyroidism who experiencing a major trigger. Okay, so early treatment of thyroid disease is equals to strong prevention. Okay, so let us look at thyroid treatment, how it is treated at the hospital. I will say that thyroid is a life-threatening medical emergency caused by extreme high thyroid hormones activity. It usually happens in people with untreated or poorly controlled hypothyroidism, often due to grave disease. Also talk about treatment in the hospital is aggressive and it is done in the ICU. It is a medical emergency and it is always fatal. So please, if you are experiencing hypothyroidism, make sure you get properly diagnosed and treated. Okay. So how thyroid is treated at the hospital. So the treatment focuses on 5 main goals. The first goal will be block the effect of thyroid hormone beta blockers. Doctor give IV beta blocker usually propranolol, sometimes Esmolol, especially if heart rate is very high. So IV of beta blocker may be prescribed and administered at the hospital. So this helps low heart rate, reduce blood pressure, decrease tremor, reduce risk of heart disease. Okay? We also talk about number 2 step will be stop new thyroid hormone production. So anti-thyroid medications are given to help stop new thyroid production. PTU often preferred initially. Okay, this drug stop the thyroid from making more hormones. PTU also reduce conversion of T3 to T4 to T3, the more active form. Okay, so block release of stored thyroid hormone iodine. After anti-thyroid medication is given, doctors administer low-cold iodine or potassium iodine. Important iodine is given after PTU, metamazone, to prevent worsening condition or worsening hormone release. Steroid protect organ and reduce hormone conversion. Okay, so doctor give IV corticosteroid, which is steroid like, and hypocorticosteroid. These are steroid. Yeah, injection is given. So this help reduce T4, T3 conversion and protect against adrenal insufficiency. So it also reduces inflammation. So supportive intensive care, because thyroid storm affect the whole body, supportive treatment is critical. Oxygen, IV fluid, cooling blanket for high fever. Acetaminophen, not aspirin, it's also administered. Treatment of infection, if present, could also be completed. Okay, heart rate monitoring is very essential. Sometimes ventilator support. Okay, if heart complication occur in severe heart failure or dangerous arrhythmia, help ICU cardiac management is have to be called to help. Diuretic or if the four provider who provide direct should be contacted. Advanced life support if needed. Okay, rare or severe cause. If medication do not work, plasmapheresis, remove thyroid hormone from blood. Energy, thyrostomy. It is rare. It is radical removal of the thyroid. What is dangerous? Train stone can affect heart failure, stroke, severe dehydration, multiple organ failure, death if present, if untreated, I mean. So thyroid stone can cause heart failure, so make sure you seek medical doctor immediately. It can also cause stroke. It can also cause severe dehydration, multiple organ failure, death if untreated. So mortality can be 10 to 30% even with treatment. Which is why rapid ICU care is critical. Okay, so we're going to be leaving our live broadcast here today because time is well spent. I'm going to work tomorrow morning as early as 4 a.m. So this is almost 4:43. Okay, so we're going to stop here today, but to continue tomorrow. You know, it is everyday thing, so we'll continue tomorrow. Until I see you again, this is Gateway 101. Thank you for watching. Bye for now.